Hello students, so now let's discuss the answer to the next one base analytical question which was posted yesterday. So this was the question in which a 22-year-old nulliparous patient was referred from the periphery and she had an ultrasound report that showed an intrauterine G-sac with a mean sac diameter of 30 mm and there was no fetal pole. What is the most likely diagnosis in this case? So whenever we are assessing viability, we go in a stepwise manner. That is, first we try to see if there is fetal heartbeat. If there is no fetal heartbeat, we will check if any fetal pole is seen. If the fetal pole is seen, we measure the crown rump length. And in case the fetal pole is not seen, then we measure the gestational sac. So, in a pregnancy where the crown rump length is more than 7 mm without any cardiac activity, or the gestational sac is more than 25 mm, but we cannot see any fetal pole. So, if this is the situation, the diagnosis is missed abortion. What about the second option, that is pregnancy of uncertain viability? So in this situation, either the sac is too small to see a fetal pole or the fetal pole is too small to see a fetal cardiac activity. So in the same question, if I had given you that the crown rump length was less than 7 mm and there was no fetal cardiac activity, or the gestational sac is less than 25 mm and fetal pole is not seen, then the probable diagnosis would have been pregnancy of uncertain viability. So coming to the final option, that is molar pregnancy. So the molar pregnancy can be either a complete or a partial mole. So in complete mole, the typical ultrasound appearance is that of a snowstorm appearance. But in partial molar pregnancy, there can be cystic spaces. Sometimes we see some fetal tissue as well. And at times there can be just a gestational sac which is seen, which can mimic a missed abortion. So given the scenario, the single best answer is missed abortion. If the missed abortion was not given in the option, if you get a scenario like that, in that case, you can go for molar pregnancy. So the best answer here is missed abortion.